All right, in the second part of our facial lecture and slide presentation, we're getting into electrotherapy, light therapy, and how it can treat the skin. So there are two different types of electrotherapy, which are galvanic and high frequency. These are not to be used on clients with metal implants, pacemakers, heart disease, epilepsy, pregnancy, high blood pressure, fever, infection, insufficient nerve sensibility, open or broken skin, and fear of the procedure. An electrode is the applicator for directing the electric current from the machine to the client's skin. And I know all of you are familiar with the mushroom that's depicted here, and there are electrodes in different shapes and forms, some smaller to get in, to tighter places. So galvanic machines have a positive anode, and they have a cathode, which is a negative setting. And these have different effects. A positive electrode can perform cataphoresis. A negative can perform anaphoresis. So deincrustation, this is using galvanic current to soften and emulsify hardened sebum stuck in the hair follicles. And then iontophoresis helps to penetrate water-soluble products that contain ions further into the skin. Microcurrent is a form of galvanic treatment that uses a very low level of electrical current. Has many applications in the skin, but it's best known for tightening and producing and lifting effect for aging skin that lacks elasticity. High frequency current, this is an electrode. We use an applicator for directing electric current from the machine to the client's skin. We can do a direct application where we're using an anode to directly apply it to the skin, and we can also do an indirect application where the client holds an electrode. These are used to stimulate blood flow and to help penetrate products. They're also good for acne skin because it produces ozone, which has a germicidal effect. Light therapy, infrared lamps are used to heat skin and increase blood flow. LED or light emitting diode, used to heal, minimize redness, warm, lower level tissue, stimulate blood flow, and help acne prone skin. So there are different light waves that we use for different results on the skin. An example of this is the blue light is used for the acne prone skin, and the red light can treat aging and redness. And then there's also green and amber. So there's more than just blue and red that can help with hyperpigmentation and tone and texture and all that good stuff. So microdermabrasion, this is a mechanical exfoliation that involves shooting aluminum oxide crystals or other crystals at the skin with a handheld device that exfoliates dead cells. The machine that we have, it lays the crystal. So the act of laying the crystal helps to exfoliate, where some of them will kind of shoot them at your skin, more of a sandblasting effect. So again, this produces fast, visible results. It treats surface wrinkling, aging, and this requires extensive training because if you go too aggressive, you can injure someone. So facials to treat basic and specialty skin types. Preservation, we want to maintain the health of the facial skin. Corrective, we're trying to correct some skin conditions such as dryness, oiliness, comedones, aging, and minor conditions of acne. So some guidelines for facial treatments. We want to speak quietly and professionally. We're trying to induce an atmosphere of relaxation. We want to explain the benefits and answer any questions, so make sure you're familiar with your product line. We want to work in a quiet atmosphere. You want to have the lights low, some spa music playing. You don't want to make unnecessary noise or initiate unnecessary conversation. You want to maintain a clean environment, follow systematic procedures. We always warm our hands before placing them on the client, or we warm the product in our hand. And we need to keep our nails smooth and short because we don't want to accidentally scratch or potentially stab your client, which could be very, very bad. And then we're going to analyze the skin because we need to know how we need to treat the skin, what products we need to choose. So a basic facial application, this procedure is listed in your book, and we did go over it in the lab, which is pretty much cleansing, toning, massaging, and moisturizing. You can use a physical exfoliant in a basic facial if you choose to. But things like peels or enzyme peels or electrotherapy treatment, those are all upcharges. So you need to add those to your price. So some special problems, there are a number of special problems that must be considered when you're performing a facial. Dry skin is an insufficient flow of sebum. We don't have enough. And then oily skin is caused by hardened masses of sebum in the sebaceous glands. So we need to treat those per the condition. You know, we don't want to use overly emollient products on oily skin, and we don't want to use things that may be a little bit more stripping or detergent based, surfactant based on drier skin. So you need to make sure that you're choosing the appropriate product. Special notes for acne skin. We want to reduce oiliness working under a medical supervision. Again, as I stated earlier, if they have really full-blown cystic acne, that it's not more than just, you know, a few pimples here or there, you really need to refer them to a dermatologist. It's not something that we can necessarily treat in a facial setting. They need prescriptive medication. So facial treatments for men. Men are having more facial treatments than ever before. You always want to move allowing for the pattern of the beard. You want to use downward and outward movements if you're working along the beard. Use sponges instead of cotton pads on a man's face because the cotton will leave lint in his beard and you'll have to spend time removing that. We want to consult and give home care. We will make sure we're conducting our consultation in a well-lighted area with a mirror, educate the client about at-home and salon procedures, and organize products for retail and explain each if the facility that you're working in does retail. Aromatherapy. In the basic facial, we can use essential oils that improve the efficacy, which means effectiveness of many skin care preparations. Again, you're going to ask about allergies. And also just from inhaling or smelling different scents can help enhance physical, emotional, and mental well-being.